you've been visiting picket lines this morning. What's the mood among junior doctors today?
I think junior doctors are very motivated and are standing united because they know what the government's doing. They know how bad this imposition is going to be for the future of our NHS, for staffing levels, for morale, for patient safety and for the delivery of healthcare services across GP and in hospitals. And we really need to fight the imposition and get the government to come back to the negotiation table.
When we spoke last time ahead of the last strike, you were talking about how important it is that the government listens to junior doctors. Since then, obviously, we've had the imposition. Do you think strikes are going to make the government listen and make them row back from that?
Unfortunately, junior doctors are in a very desperate position right now. We've marched in our tens and thousands, we've signed petitions in our hundreds of thousands, yet the government still fails to listen. We've conducted 2 24-hour strikes and the government hasn't come back and listened to our concerns. We now face an imposition in only a few months' time and we're left with no other choice to take to the streets. But we do this with a heavy heart because no junior doctor wants to strike. We want to be with our patients, we want to be in the hospitals or in the GP consulting room and actually deliver the care that we love to deliver to our patients.
If the government continues to push ahead with the imposition and you go ahead with the next few strikes that have already been, the date's already set, how long can junior doctors sustain a campaign of strikes against the government?
I think the real question is, are junior doctors ever willing to compromise on the safety of care for patients or actually the future of the NHS? We are at the front line, at the coalface of it. We know what services are sustainable, how we're delivering care, where the gaps are, where the resources are needed, and where actually we're really struggling in general practice, in accident and emergency departments, in paediatrics, in obstetrics and gynecology. We know where the actual gaps are, and if you don't listen to us, and actually if you impose this contract, we know how disruptive this contract is going to be and actually the compromise to quality of care.
Obviously, this latest strike is the first of 3 48-hour strikes, obviously an escalation from 24 hours. Where can you go next? What's the next escalation possible?
So the BMA are conducting a judicial review alongside these strike actions because actually the government committed to imposing a contract without actually doing an equality impact assessment to see how certain groups within the junior doctors demographic will be affected. So we know that more than 50% of current junior doctors and more than 50% of medical students are women who actually have a significant commitment to childcare, working weekends and night shifts. We need to be more flexible for our workforce. So the government's just totally bulldozed this contract in without actually understanding the workforce and understanding the implications. Already chief execs in hospitals are saying that the contract that they've proposed isn't deliverable and isn't sustainable. They're having difficulties even trying to implement the new contract for the August deadline. So actually this is a whole pan-wide managerial issue as well as a consultant issue as well as a junior doctor issue. So we will continue to escalate till we feel that our voice is listened to.
Could that include a full walkout, including emergency, those doctors providing emergency cover?
I think all options are on the table right now and we have to consider all options to get the government to come back to the table for a negotiated settlement.
Obviously public opinion we've already talked about, that's very important for all strikes. The opinion polls seem to suggest that public opinion might slip if the strike includes those doctors providing emergency cover. Is that a concern? Is that something that's important when you're considering tactics at the moment?
We're doctors, we don't play politics, and actually the reason why we haven't escalated to a full walkout right now is because we genuinely don't actually want to strike. We don't want to be on the streets, we want to be in the hospitals. We genuinely don't want to have to be pushed into this corner. But after 2 24-hour strikes and now 3 48-hour strikes, the government is still not listening. We have to consider all options that will force the government to listen. We are deeply sorry to the disruption that this will cause patients, but we do have consultants, we do have other staff in hospitals at that time, but we need to exert as much pressure as we can on the government to get them to come back and negotiate with us.
Just one final point. Obviously, the government are saying that the imposed contract is actually, I think they're referring to it as a midway point. They're saying that it contains 90% of the areas that the BMA wanted in the contract or agreed to. Can you just remind us of specifically the details in this imposed contract that the BMA is opposed to?
So right now, we already have a 7-day NHS, and junior doctors and the BMA are 100% behind improving services and the quality across the NHS across 7 days. But actually, if you take a service that's only staffed for 5 days and try to stretch it over 7 days, we're going to have significant gaps in the rota. Already, some rotas are 50% understaffed, so we've got junior doctors actually working and have the responsibility on their shoulders for 2 or 3 doctors at a time. Putting more responsibility on their shoulders is going to compromise the quality of care we deliver to those patients, and ultimately it's not going to be safe, and that's what the fear is. There's no commitment to actually increasing the number of staffs coming through, increasing the resources, addressing the actual paperwork, the administration, the bureaucracy in the NHS, and actually how we change the delivery of services to make them sustainable. All they've said is we want more from existing doctors with no funding, with no resources and no change to staff, and that simply isn't safe, and that's what this contract is trying to do.